For the first time in decades, the U.S. is experiencing a sudden and unprecedented drop in drug overdose deaths. National surveys compiled by the CDC and obtained by NPR show a nearly 10.6% decline, a major shift from the last several years. During the pandemic, fatal overdoses increased by double-digit percentages. Joining me now here in studio, Dr. Vin Gupta, pulmonologist, global health policy expert, and an MSNBC medical contributor. Bottom line is, thousands of lives are being saved. Why do we think this is?
Well, Chris, I think part of this is awareness. We're talking about it more. We know there's a lot of illicit drugs that are laced with, say, fentanyl on the streets. And what has happened at the state level in places like Seattle, that my hometown was profiled by the NPR, this NPR exclusive, was this notion that we know there's more dangerous narcotics on the street. We have to make sure naloxone, the treatment for an opioid overdose or narcotic overdose, is in the hands of frankly, drug users. And that's what we're seeing here, that even amongst those that are using these substances, they know what to look out for the signs of an overdose and to administer it to somebody, say a friend, that might be co-using one of these substances. So that's a clear reason why we're seeing these results.
You know, let's temper the hopefulness. The fact is, still about 100,000 people die every year from drug overdoses. What are the programs? I mean, obviously, naloxone is one of the initiatives that has made a difference. But what are the programs and initiatives that are proving beyond that to be the most effective?
Sure. Well, I think it all starts with making sure that we're investing in mental health services. And so we've seen, for the Indian Health Service, as one example, them really investing. They have a community that's ravaged by some of these problems here. So we're targeting from a health equity lens where there's need, marrying it not just with bandage approaches, let's get naloxone to people, but what's the up funnel reason we're seeing these types of behaviors? And that's mental health. And so there's mental health services that are pretty robust. There's frankly clinics where we can help people off ramp from a high. And that's what we've seen in places like San Francisco, in Seattle, and other cities that have really been riven by this problem of high overdose deaths. Let's allow them to come off, to withdraw safely. And so this is a multimodal approach. But at the end of the day, we've made naloxone over the counter, Chris. That's a big deal. That means you can pick it up. Yeah, it's expensive, but that price point's coming down. But we're getting these tools in the hands of people, and that is, frankly, serving a clear need and having a real impact.
Dr. Vin Gupta, always great to have you, but especially good to have you here in New York. Thanks so much for coming on.